I hope everyone's doing well. Today we are going to be covering sows and piglets, but before I started the lecture, I just wanted to check in and make sure everyone was travelling okay. I haven't received many comments or questions about the pig lectures, which I thought might be due to the fact that everything makes perfect sense and you're all ticking along fine, or no one's listened to the lectures, or no one's interested in pigs. So I certainly hope it's not the latter. And I know it's the end of semester, everyone's getting a bit stressed, including the lecturers, but just wanted to say again, if you do have any questions or comments, then certainly don't hesitate to reach out to me. Okay, let's get started. I'm hoping this lecture might be a bit quicker than previous ones. We'll see how we go. Hopefully that's working now. Okay. So today, as I said, talking about sows and piglets, but I'm going to start with this slide, which we seem to be coming back to a few times through these pig lecture series. So this is talking about our breeder productivity, which relates back to reducing our fixed costs on farm, which relates to improving our overall cost of production. And we're talking about mostly the farrowing house today and activities in the farrowing house, and that is going to relate mostly to reducing our pre-weaning mortality. So previously in our reproduction lecture, that sort of related more to our pigs born alive per litter and the number of litters per mated female per year. So hopefully it's all coming together in terms of how to think about it with this sort of overall understanding. So the first point that is important to make is that a low birth weight will reduce your piglet survivability significantly. So this is unpublished data, but it was research that was done here in Western Australia. On the x-axis we have the time in days, and then on our y-axis we have a survival distribution function. So 1 meaning survival, 0 obviously meaning not. And then we've divided our piglet weights into quartiles. So highest, middle, and lowest quartiles. So you can see here piglets that are less than 1.3 kilos at birth are considered a low birth weight. And looking at these lines, you can see that if you are a piglet in the 4th quartile, your chances of survivability reduce by nearly 50% as time goes along. So traits such as birth weight or number of small piglets born and the uniformity in a litter, so that's the overall size variation in a litter, are highly heritable traits. So remember in our genetics section, we talked about there are traits that are highly heritable and ones that aren't so much. But they appear to be negatively correlated with litter size. So that kind of makes sense, because if your litter size increases, then that's going to provide less space in the uterus for all the piglets to grow. Therefore, you're going to end up with lower birth weights. Now, this is not so much a problem in Australia, but if you go overseas, particularly in high pig producing countries such as Denmark, the Netherlands, the US, etc., they have very high litter sizes, so their total borns will often be around 16 to 20, 23 piglets, which is pretty crazy. When you look at Australia, we normally get around 12 to 13 total born in our litters. But saying that, because they have focus their genetic selection on litter size, then that has meant it's also had an impact on birth weight as well. And so they end up with a lot of small piglets, and when you get piglets less than 1.3 kilos at birth, then their survivability reduces. So other things that influence birth weight is our progeny. So remember that gilt progeny will generally have lighter piglets than sows, and that's probably because their reproductive tract is still developing, so therefore not as much space for piglets to grow. Another thing that might influence birth weight is a concept called bump feeding. So remember when we were talking about our housing lecture and how we manage our sows in housing, and we talked about how we have to restrict feed sows through their pregnancies, because if they eat too much, then they can get too fat, and that can have implications on their lactation. So they normally receive around 2.5 to 3 kilos a day as a ration. There is some thought that if you increase that slightly at the end of their pregnancy, then that nutrition, extra nutrition, could go to the piglets and help them with weight gain in utero, which means they obviously have higher birth weights. It's sort of a bit hit and miss with the research around this, and the current recommendations in Australia is not to do that with our genetics. But saying that birth weight is an issue and that piglets less than 1.3 kilos are at increased risk of not surviving, there are things that we can do in the farrowing house in terms of good management to try and improve survivability for these little guys. And that's partly what we're going to focus on in this lecture. So another couple of things just to be aware of if you ever find yourself in a farrowing house. Another thing, as well as birth weight, that can indicate poor survivability is a thing called meconium staining. So meconium is the first feces that a piglet or any neonate will produce, and it's sort of that browny orangey colour. If a piglet comes out with meconium all over it, that is suggestive of a stressful birth, and it could have experienced anoxia, so a lack of oxygen. Maybe it took a while coming down the birth canal and had a period of anoxia. So when you see piglets like that in the farrowing house, you just need to be aware that they need extra attention to improve their survival. Another thing to be aware of is this condition called intrauterine growth restricted piglets. So these piglets, once again, not so much an issue in Australia because of our litter sizes, but certainly if you go overseas, in countries like Denmark, you will see a lot of these piglets. So they are piglets that have had their growth restricted in utero because of large litter sizes. And you can distinguish them by this dome-shaped head. They're also born with lower glycogen stores in their liver, and they've just got less vitality to them, and they usually have lower birth weights as well. Okay, I'm just going to quickly check that I'm recording, and yes, seems that the slides are being shared. Okay, so now what we're going to do is quickly review farrowing. So we did talk about this a little bit in ANS 101, but that was all the way back in semester 2 last year. So if we go back to our reproduction lecture, we had our follicles in the ovaries that grew, and as they matured, they released estrogen, which changed the behavior of the sow. That made her go into standing heat for 56 hours on average. She then got mated. If she got pregnant, then that follicle would turn into a corpus luteum and release progesterone. And progesterone's the hormone that maintains the pregnancy. So we've gone through our pregnancy, no problems, and now the piglets are ready to be born. So when that happens, they release corticosteroid hormone, which acts on the sow's uterus to release another hormone called prostaglandin. And that prostaglandin will go and have an effect on the ovaries and tell the corpus luteum to stop producing progesterone, and it will stimulate the release of relaxin. And relaxin will act on the cervix to dilate the cervix and open up the birth canal. The prostaglandin will also have an effect on the sow's pituitary gland and cause release of oxytocin. So the oxytocin will go into the mammary glands and cause a contraction of the smooth muscle there, so you get a milk letdown. And the oxytocin will also have an effect on the smooth muscle in the uterus and cause contractions there, which will help to push the piglets out. So in terms of behaviour and the overall process, so we talked about in the housing lecture how the sows, when they're about to give birth, have a real motivation to build a nest, and that will happen around 12 to 24 hours before farrowing. They get a milk letdown, and then the sow quietens down, lays on her side, and starts straining, and you'll initially get a passage of some blood-tinged fluid and maybe some meconium. So the first piglet is born, the sow will strain between each one, and normally you'd expect a piglet to be born every 15 to 30 minutes. And a lot of farms will use timers to monitor that piglets are coming out at this frequency. I guess the total time for farrowing will depend on litter size. Sometimes it's but less than 3 hours, but it can go on for longer, 6 to 8 hours. In those kind of scenarios, energy becomes a real issue, and that's why offering the sows fibre in the form of straw can be really helpful in terms of just giving them that energy to last the farrowing process. The placenta and membranes around the fetuses will be either delivered throughout the farrowing or at the end. Now, the problem with farrowing in sows is that often sows will like to farrow overnight. The issue with that is that generally there are no staff in the farrowing house to assist if the sow does need help. So once again, overseas, where labour is a lot cheaper, a lot of countries will employ staff to be in the farrowing house overnight. In terms of the assistance that you can give sows during farrowing, the first is to do an internal examination. So take all your jewelry off, put one of those long gloves on with a lot of lubricant, and have a feel in the birth canal. And sometimes you might be able to feel a piglet that's stuck. And if you do, you'll either be able to pull the piglet by its legs or hook under the jaw or around the eyes and pull it out. Another thing that you might be able to do is give the sow an injection of oxytocin. So remember, the oxytocin is the hormone that causes contraction of the uterus as well as the mammary glands, and you can give that in injection form. Of course, before you give it, you need to make sure that the birth canal is clear and there's no blockages. Another thing that farms will do to avoid sows farrowing overnight is induce their sows. So they give them an injection of prostaglandin to kickstart the farrowing process. You have to know what you're doing if you're going to do that. You need very accurate mating records because you don't want piglets being born that are less than 112 days gestation age. And also there's some health and safety issues with using prostaglandin injection. So asthmatics and women can't handle it, and it can cause some aggression in sows. Okay, so once a piglet has been born, and in ANS 101 you would have seen some videos of this, the piglets pop out and then they make their way to the teat. And when they reach the teat, they might sample a few and get their first dose of colostrum. Now, the piglets that come out first will likely go to the anterior teats, or the teats at the front, because those are the high-producing teats. So therefore, they're going to have more colostrum and more milk, and therefore more antibodies. A teat order is generally established within the first 3 days of a litter being born. So remember, pigs like to form a hierarchy in any group, whether that be mixing sows or in the litter. Some common problems immediately after birth, probably the biggest is overlays. So that can happen when you've got really fat, heavy old sows, because they're less likely to get up when they do sit on a piglet. Or if your sows are distressed for some reason, so if that's because they're experiencing issues with feed or water supply, or they're uncomfortable, or they're stressed, them moving up and down in the farrowing crate increases the chances of a piglet getting laid on. Another risk is that if your piglets are spending a lot more time under the sow. So remember, in our housing lecture, we talked about the farrowing crates, and within a farrowing crate we have the creep area for piglets. So that's meant to be a nice, inviting, warm environment for the piglets to hang out in, and then they go to the sow when she calls them for a feed. If the creep, for example, is not as inviting as it should be, or if the piglets are hungry because the sow's not milking properly, then they may spend extra time under the sow, and that obviously increases the risk of overlays as well. And then I guess one thing I haven't put in there, which is another risk, is the housing design. So obviously a crate is the best in terms of saving piglets, but if we're housing them in pens or in farrowing huts, then overlay risk increases. Chilling is another common one. So when piglets are born, I'll show you in a sec, but they have very low energy stores and very low fat stores. So it's really critical for them to get to the teat as soon as possible. And chilling is a common cause for piglet losses. Poor colostrum intake is another common problem. So for whatever reason, the piglet can't get to the teat in the first 24 hours after birth. Poor milk intake is another common problem. Often you'll see clues of poor milk intake when you spend enough time in a farrowing house. So some clues might be this facial necrosis injury. So that is from the piglets biting their litter mates' faces, and that's usually because of increased competition for milk. So that would suggest, if you get a lot of these types of injuries, that you've got an issue with milk production in your sow. Another clue is that you'll see a lot of injuries on the wrists or the knees of piglets, because they're spending a lot of time kneeling down under the udder trying to get as much milk as possible, and they're damaging themselves on the flooring. Or teat wounds. So if the sow's really scratched up, then that may suggest things aren't quite right. Diarrhea is another common problem in the farrowing house, usually due to E. coli or coccidia. And then savaging can also be an issue, so where sows attack their piglets. It's mostly seen in gilts, and we don't really know why it happens, but there's some possibilities listed there. You can use medications in these sows that have aggressive tendencies towards their piglets to try calm them down to get them through the lactation. Okay, so a word on why colostrum is so important. So colostrum is obviously that antibody-rich milk or secretion that is produced by the mammary glands in the first 24 to 36 hours after birth. There's two reasons why colostrum is so important. The first is that it provides energy for heat production and metabolism. So on this graph, we can see on the left-hand side the energy available to the piglets at birth. So they have a little bit of glycogen storage and not much lipid at all. And then we have the energy requirement for survival. So that includes maintenance, physical activity, retaining energy, and thermoregulation. And you can see, I'm sure you can appreciate the imbalance there. So that's why it's critical for piglets to get onto the teat and consuming colostrum as soon as possible. Another important reason for consuming colostrum is passive immunity. So as I said, colostrum is very rich in immunoglobulins or antibodies that are passed on from the sow. So these antibodies are proteins, and when we talk about protein absorption in Vet 272, the biochem unit, in the final week of semester, we'll touch on this as well. But just to make the point now, this is our small intestine in the picture in the bottom left. So the small intestine is made up of villi, which are these finger-like projections that increase surface area. And then lining these villi are our enterocytes. And what happens in a neonate mammal, is that the enterocytes normally are joined together, but in a young animal, they actually open. So you've got a gap between the cells, and that gap allows for large protein molecules, such as your immunoglobulins, to pass through into the bloodstream to be absorbed. That gap is only open for about 24 hours after birth, and then it closes. So then if you give a young animal colostrum at 3 days of age, for example, you're wasting your time, because the piglet or whatever animal is not going to be able to absorb it over their small intestine. Another important point to make is that the colostrum production will reduce as time goes on, which makes sense. So we can see here some more research done in the pig. So we've got time on the x-axis, and then our concentration of IgG, which is the most common antibody, reducing over time. So and this is in relation to birth of the first piglet. So if you're the 12th piglet born, and it's taken 6 hours or whatever for the farrowing process, then you're obviously going to be getting a lot less colostrum than the piglet that came out first. And this is also some more research just to show that as litter size increases, then colostrum intake decreases. So we've got all these things going against us. What are some strategies that we can use in the farrowing house to try and increase the chances of survival for our piglets? So the biggest motto to live by, I guess, if you're working in a farrowing house, is to dry piglets and plug them in. So once again, if you go to a farm in Australia, you might not see this, and that's because usually there's not enough staff to do these kind of things. But overseas, you will see staff drying piglets off as soon as they've been born, because when they come out of the birth canal, they're obviously very wet. And then they actually go and plug them into a teat to ensure that they're getting that dose of colostrum. So you can either dry them with a towel, or in the picture on the top right here, you can see they've used a powder. Colostrum supplementation is another possibility if you've got some piglets that you're worried about. So if they're low birth weight, or they have meconium staining, or they were the last to be born and or they have that intrauterine growth characteristics, intrauterine growth restriction characteristics, then you can use colostrum supplementation. But once again, you waste time if you do this at more than 36 hours after birth. You want to keep your environment correct in terms of minimizing drafts and getting your temperatures right. So remember, sows like to be kept at around 18 degrees, but our piglets like to be nice and toasty warm at around 32 degrees. So making sure you've got your creep environment correct. Good hygiene goes without saying. You can use a coccidiostat within 2 to 3 days after birth. You can make the creep area more attractive, and some research that was done in this area in swap pens. So remember, the swap pens are one of the alternatives to a farrowing crate, where you can swing the gate open and keep the sow enclosed for the first week after birth, for example. But saying that, in those pens in particular, or the PigSafe pens or the UMB pens, you want to make your creep more attractive because you want to reduce the risk of overlays. So some research went into that, and they looked at increasing the intensity of the light in the creep, and they found the brighter the light, the piglets tended to spend 7% more time in the creep. So some interesting research there. Split suckling we'll talk about in a sec, and cross fostering we'll talk about too. So split suckling is a technique that you can use to try and increase the chance of survival in your small piglets. So the technique involves selecting your top 5 or 4 piglets in the litter, letting them have their dose of colostrum, and then once that's happened, separating them out. So you can see that's what they've done in this picture, and allowing the little guys to have a chance for a couple of hours. So obviously should occur within the first 12 hours after birth, to ensure that you get that gut permeability and maximize the amount of colostrum coming out of the sow. Another thing that can be done is cross-fostering. So there's a few things that you might be trying to achieve if you decide to cross-foster. The first is that you would be evening up the number of piglets to number of functional teats. So in Australia, most of our sows have 12 functioning teats. Once again, if you go to other countries, then they can go up to 16 teats. But what can happen is that a sow might have 14 piglets, for example, but then we've only got 12 teats. So then we have to move some piglets around to try and even things up. Another possibility for doing cross-fostering is to make up a... So, oh, sorry, the microphone did something a bit funny there. Is it still okay for you guys? I'll just check the comment. Yep, okay, cool. Thank you. So a nurse sow is if you have a number of small piglets across litters in the farrowing house, what you can do is you can get them all together and make up a litter of smallies, and then put them on a sow that is already going through lactation. Perhaps she's done really well and been able to wean her piglets early. So then you can go and put your smallies on that sow because you'll know that they'll be well supported. And the competition will be less because of the reduction in size variation. Another reason why you might cross-foster is to stimulate more milk production in your gilts. So very important in gilts. Often, as I said before, they have lower litter sizes. So therefore, in a gilt, it's probably not uncommon to have 9 piglets, but she'll still have 12 teats that could possibly be functional. So you want to load up the gilt from 9 to 12 piglets to make sure that each of those teats gets used, because if they don't, they will be non-functional in her next lactation. So therefore, you're losing capacity in your gilt. So some basic rules of cross-fostering is that you don't want to move piglets until they've received their colostrum. So we normally cross-foster after the first 24 hours after birth. Although saying that, you want to do that before the teat order is established, which is around 3 days. You foster early in the morning so you can monitor the piglets that you've moved through the day. You obviously record what you've done and monitor them very closely. Loading up gilts, as I said, is very important. You don't want to cross-foster for the sake of cross-fostering, so you really want to limit your movement. It's better if piglets can stay with their birth sow. And if you're going to be moving piglets, it's better to do the very small or the very large. And if you are going to make up that litter of smallies, like I said, when we're talking about nurse sows, you don't want to put them on a parity 8 sow, for example, if you've got small piglets, because one, she's obviously going to be a much bigger girl, so the chances of overlays are higher. Her udder line, because she's bigger, is going to be higher off the ground, so that might create issues for small piglets having access. And also her teats are going to be much thicker because she's been through a few lactations, and that might be difficult for small piglets to get their mouths around. So really, when you're using a nurse sow for a litter of smallies, you want to be using a P2. So not a gilt, because their milk production is less, remember, because their mammary glands are still developing. Okay, a few points about milk production. So as I said, milk production is associated with the release of oxytocin, and you need this oxytocin for milk letdown. So another thing to remember about pigs is that they're not like cows where you can go up to the teat and just milk it. You need that oxytocin for the milk to be let down. And that oxytocin is released when you have a suckle reflex, and it will release the milk for that individual teat. So if you have a teat that's not getting suckled, then you're not going to get a milk let down in that teat. And this is a evolutionary adaptation that pigs have because of their large litter sizes. Now, in terms of volume of milk production, in early lactation, that is going to be influenced by litter size, because obviously if you've got more piglets suckling on more teats, then that is going to produce more milk because you've got more functional teats. Birth weight, so I guess that's related to piglet vigor. And as I said, the gland will dry up if it doesn't get used within 24 hours. In late lactation, the things that are going to influence milk production is the nutrient intake of the sow and how available her body reserves are for making milk. So that's why when sows are lactating, they can eat as much food as they want to. And hopefully you remember from ANS 101, sows will have a letdown around every 40 to 60 minutes, and milk will come out for about 10 to 20 seconds. So when you go into a farrowing house, you often see piglets rubbing the udder, and that is also very important because that massage of the teats, I guess, promotes oxytocin release, and that will happen before and after a letdown. But most of the time when you see piglets nuzzling the udder, they're not going to be consuming milk. That's only going to happen for that 10 to 20 second period of time, about every hour. And you'll know when that's happening because the sow will usually call her piglets over first. They will have a bit of a rub, and then there's that really concentrated period of them all suckling the milk in. Now, what can have an effect on milk intake? So these pictures represent different possibilities here. So the first is the piglet not being able to get to the udder, and that could be because of chilling or illness, or it could be because of a physical inability, such as this splay leg. So splay leg it's not uncommon in the farrowing house. If you see a piglet with all 4 legs affected, then that piglet has to be euthanized. But if you just see the back legs affected, then you can try and treat it by strapping the legs. And then over time, things improve and that piglet is usually okay. They don't really know what causes it. Maybe stress during farrowing, genetic component, low birth weight or sour nutrition during pregnancy, but it's all a bit of an unknown. Other things that can influence milk intake is udder edema, which is this picture here. Probably a little bit hard to appreciate, but if you look at this picture of a sow's udder, you can see the different mammary gland is nicely defined. When you look at this, you can see it's kind of just all one line. So you don't have that definition of the different glands. So that is where you get extra fluid building up around the mammary glands, and that increases the pressure around that area and stops milk flow. So udder edema is associated with a high feed level. So when I mentioned before, we want to restrict our sows during gestation, this is one of the reasons to avoid this. So if they eat as much as they want during pregnancy and get too fat, then that increases the risk of udder edema. It's been associated with constipation, reduced exercise, low water intake, things like that. Another common problem is MMA, which stands for mastitis, metritis, and agalactia. So it's once again probably a bit hard to appreciate in this picture, but it's basically a bacterial infection that gets into the mammary gland. Obviously, I'm sure you've heard about that in dairy cows. Most common in the first 12 hours to 3 days after farrowing, and the affected mammary gland excuse me, becomes very hard, like rock hard, red. The sow develops a fever, she gets really unwell, goes off food, and when you try and express any milk from that gland, not us, but when a piglet tries to get any milk out of that gland, not much comes out. So the sow needs to be treated with antibiotics and anti-inflammatories, but it can make them very unwell. Okay, so I talked about supplementary feeding of our piglets. When do we do that? So that's mostly for our disadvantaged piglets. And we've talked about the factors that make a piglet disadvantaged. What you can do if you are supplementary feeding some piglets is keep them in a humidity crate until they're strong enough to go back to the sow, because chilling is a really big risk factor. And yeah, we use stomach tubes for colostrum, or you can bottle feed. Okay, so now we'll just touch on, I thought this would be a quick lecture, but I seem to have yabbered on for a bit, sorry about that. So creep feeding is another technique that you will see in the farrowing house. So creep feeding is where you offer solid food to piglets in the farrowing crates or pens before weaning. And the idea is to familiarize them with the concept of solid food. So when the piglets are weaned, which we'll talk about in a sec, it's a very abrupt process where the piglets are taken off the mum and placed into different housing. So therefore they have to adapt to a new diet very quickly. So going from milk to a solid food can be a very foreign concept for the piglets. In nature, This obviously happens over a much longer period of time, and the piglets have a chance to start exploring solid food, and it's a much gradual process. So to try and help with that, some farms will offer solid food in the farrowing crates to get the piglets exploring it. I guess it's a form of enrichment as well, to see, and some will consume a little bit just to get their gut familiar with solid food, and also get them familiar with the concept of solid food. So when you look at the data around using creep feeding, because obviously it's another expense for the farm, and most of it gets wasted through the slats if they're just playing with it and exploring it. There is a large variation within litter of the piglets that will eat it and who won't eat it, and there's a large variation between litters as well. And this is just some data to show you how gradual the increase in creep feed is over time. So this is creep feed disappearance in grams per day per litter. And then we've got day after birth on the x-axis. And if you recall, we're weaning our pigs around day 21 to day 28. So you can see if you just wait that extra week before weaning, there is quite a significant increase in creep feed consumption in general for the litter, and that's going to be more beneficial in terms of the transition into weaning. If we take a further look out along the timeline, we can see that weaning at 8 weeks of age, they'd be getting 70 to 80% of their nutrient requirement from creep feed, and at 6 weeks is 50 to 60. So this is just some data. There's heaps of studies like this out there because creep feed and the potential benefits have been studied extensively. But this is just to show you an example of where they've looked at offering creep feed here, and then defining their eaters and the non-eaters, and then the piglets that were not offered creep feed. And you can see that the eaters had a improvement in their feed intake and growth after weaning, and that continued for up to 34 days after weaning. If we look at the piglets that didn't eat in the litter compared with the piglets that weren't offered food, you can see there's no statistical difference there. So it's really only benefiting the ones that do decide to eat the creep feed. Okay, and we're just going to finish talking about weaning here and the challenges associated with that. So I've alluded to it in my previous slides, but this is just to explain what's happening a little bit further. So we've got our timeline on the bottom here of birth, 3 to 4 weeks, which is when weaning happens in commercial pig production. And then we've got 12 to 14 weeks, which is when weaning would happen in nature. So in nature, as I said, it would be a very gradual process of where the nursing bouts with the sow slowly decrease. The piglets start to spend more time away from the sow, which then allows them to explore the environment and then potentially explore other sources of food. In modern production, we wean our pigs when the gut is still developing, so that's represented in the green line, and when maternal immunity is decreasing. So when we are getting less maternal antibodies from the sow. So there's a few challenges for the piglets. In addition to that, it's also a very stressful process for the piglets, as I said, because it's abrupt. They get taken off the sow very quickly and moved into a different environment. So that's associated with mixing stress because you're introducing them to new pen mates. Therefore, they have to establish a hierarchy. you get maternal separation, which can be stressful, a change in diet, as we talked about, and a change in environment. And with a change in environment, you potentially have exposure to new pathogens, but hopefully not if your hygiene is good. So often the period immediately after weaning is associated with a low solid feed intake, reduced growth, and an increase in morbidity and mortality. So this picture just represents down here, going from on the sow into our weaner accommodation. So as a result of these stresses, we often get what we call the post-weaning growth check. So if we look at this graph on the right-hand side, on the y-axis, we've got piglet weight gain, and on the x-axis, we've got piglet age, and the pink line indicates weaning. So our growth has been ticking along. They get weaned and they go through this growth check where they go into negative growth, and it takes them a good week to recover. And that's mostly because the piglets stop eating because they're stressed and they're getting their head around the new food. Now that can also have an impact on their gut health. So remember, we talked about the gastrointestinal tract being lined with these villi, which are made up of the enterocytes. This is a microscopic view of what it looks like. If we compare a day 21 suckling pig to a day 28 wean pig, hopefully you can appreciate that the villi have been shortened in the day 28 wean pig. And that's because the pigs are not eating as well as they used to. Therefore, the enterocytes lining the small intestine are not getting the nutrition that they should be. And then that causes the villi to shorten, which means that your absorption of nutrients is not as good. So the nutrients are sitting in the lumen of the intestine instead of being absorbed into the blood system. And that then creates the potential for bacterial overgrowth, because if you've got a lot of nutrients in the lumen of your intestines, the bacteria are going to think that's Christmas on a stick and go wild. So often weaning can be associated with diarrhea as well. So with all this sort of doom and gloom related to weaning, you might be thinking in your heads, well, why don't farms just wean later? Well, it all comes back to this figure here, the number of litters per mated female per year. So if we keep the piglets on the sow for longer, then that means that she's not going to be able to come back into heat and be remated. So therefore, it reduces the number of litters that she will have in a year. Now, I've said all those challenges associated with weaning. In general, most piglets will be able to cope with it quite well, and the industry has found that around 3 to 4 weeks works quite well. But yes, you will have some piglets that you have to put in a lot more extra TLC into. Saying that, some other places might decide to delay their weaning age until 5 to 6 weeks. In the US, it wasn't uncommon for farms to wean their pigs at 2 weeks of age, but thankfully they did the research and looked at the science, and they saw that they were shooting themselves in the foot doing that, and really it was better to wean much healthier piglets. And you could see even from that creep feed consumption graph I showed you, even if you wait that extra week, that can make a lot of difference to the pigs. So with weaning, the later the better, but obviously you have to keep your breeder productivity in mind. Okay, hopefully that all made sense, but I will stay on the line if anyone has any questions, and I will see you guys next week. Thanks. Thanks, guys. Thanks.